Thanks for coming. There's a reason why I do this class, because obviously this is something near and dear to all our hearts. How many people out there have ever had low back pain, headaches? Yeah? Somehow that always happens when I ask that question. Well, let's just talk about it real quick. We as humans are funny little creatures. How many other animals do you know that use their spine like this? Not very many, huh? What do the other animals do on this planet? Don't they do this? Okay. What's the difference between this presentation and this presentation? I want to kind of really actually emphasize the point that we as humans are very, very, very strange. We're the only creatures on the planet as well where the hole, this is the skull, where the hole where the spinal cord goes actually is at the bottom of the skull. You know where the other animals all have it? In the back of their head. We're the only ones who do this. And you know why we do that? Because this is how we are. Obviously, on a functional level, it makes sense for us to be that way, because what makes humans also unique is that we have hands, right? What do we do with these things? We read, we write, we make tools, we do all the things that makes us humans very unique. But ultimately, we had to pay a price for this, because the thing that happens to us, and we're going to talk a lot about something very important as far as our health is concerned, is these little guys over here. You guys know what these things are? Discs? That's what they are. Okay, now, on cats, dogs, horses, fish, birds, well, they're all doing this all the time. How is gravity treating this? Obviously, it's a very different story, right? Now, we always know, we've all heard the term spinal column. Well, you know why we call it spinal column? Because it's a column. It's standing straight up. What do the other creatures do? They're basically a spinal beam. There's no gravity going through this. Technically speaking, if a horse hurts his disc, he doesn't have nearly as much to worry about as we do. He just hurts this, and it's not going to really translate us to any problems up and down the spine at all. What do our discs have to do along with everything else that they have to do? They have to also hold us up. Very important thing to consider. Isn't gravity always squeezing this? Right? Now, the other thing that we do, since we don't have 4 legs to transfer our weight in a nice and smooth pattern, we have 2, right? So every time I take a step, it's an impact. It's an impact. It's an impact. So what that's doing, on top of the fact that your body now has to be held up by your disc, is it with every step. Now, if you're a jogger, you can imagine that's going to be having a bigger issue as well. I want to talk about real quick what discs are all about. What I have here is a healthy disc. Let's kind of study it in detail so we can see what it is we're talking about. A healthy disc is really made out of just 2 parts. The nucleus, which is what sits in the middle, and the rest of the disc, which is what we call these little annular fibers. All they do, and their only job, and they're very strong enough to basically be intact for most of our lives, but not strong enough to be intact forever, unfortunately. The only thing they do is hold the nucleus in the middle. That's all they do. As long as that's the case, we're not going to have a problem. But there's something that tends to happen. Does that look the same as the other disc?
No.
No. What happened here? The annular fibers that we just talked about, that holds the nucleus in place, they herniate. You guys heard of the term herniated disc?
Yeah.
You guys ever heard of bulging disc? Okay, we're going to talk about what a bulging disc is all about in a second. When these fibers herniate, the nucleus does not stay in the middle anymore. It actually goes off to the side. Now, very important to understand, anybody ever seen a tire with not enough air in it? Mm-hmm. What happens to the sidewalls? They balloon out, don't they, right? Okay, and also if you look at a tire that's going flat, the rim and the ground don't have much of a distance between them. It's important to note this because usually people with disc problems wind up going to an orthopedic surgeon or to their medical doctor, whatever that happens. Usually what is the next step that takes place right after you go to a doctor for, let's say you're having sciatica, shooting down the back of your leg. You're at your general practitioner's office. He orders an MRI, correct? Okay. MRIs, don't get me wrong, MRIs are great, but there's a problem with MRIs. Don't they take them lying down?
Yes.
Is the disc behaving the same way with gravity going through it as opposed to a disc that's has no gravity going through it? Any more than a tire in a car that's being lifted up in the air versus one that's got its full weight on the car. And that's precisely why This stuff is made out of fluid. As long as it's contained from all sides, it will actually hold you up. It's very important to understand exactly how a disc works. I'm going to kind of do an illustration of what a disc looks like if you were to slice it in half. If we have a vertebra right here, and we have another vertebra sitting on top of it, and we had a disc sitting right there, the nucleus would be the ball sitting right in the middle. What holds it there are these things we call annular fibers. Very strong, as we talked about. As long as this is the case, we have several things we can count on. The first thing we want to look at is the fact that as long as this is where it's supposed to be, the two bones sitting on top and below that disc are going to be parallel. Does that make sense? Mm-hmm. Okay. Yeah. So what's going to happen if I were to tear some of these fibers? Remember, in a cat and a dog and a horse, it's really not as much of an issue. The cat winds up with one bad disc. But on us, it's a major, major, gigantic issue because remember, gravity is squeezing here. This is made out of fluid. What do you think is going to happen? If I were to take a toothpaste tube and squeeze it, and you come along and take the cap off, what's going to happen? That's exactly what happens. Remember, we're humans, so our toothpaste tube is always being squeezed. I'm standing here, I'm squeezing every one of my discs. You guys are sitting there, you're squeezing every one of your discs. Now we've lost containment. What's going to happen is this stuff is going to go off to the side. Very important to understand that the only weight-bearing portion of your disc, the main weight-bearing portion of your disc, is the nucleus. So now that I've shoved it off to the side, obviously there's a finite amount of material. This stuff winds up collapsing a little bit. Are we still going to have symmetry in this situation? The answer is obviously no. This is what happens. I'm going to kind of reconfigure this as to what it winds up really looking like in us humans. Then we're going to have a problem. Okay. I want to illustrate, if I were to take what's happening to this disc and assume that it's, let's say, here somewhere. And I'm going to do to this what is happening to that bone. Look what happens to the rest of the spine. Does that look good?
No.
Now, the question becomes, why is it then, with all these people with bad discs, none of them walk down the streets like this? That would be the first thing I would wonder, okay? Usually people with bad discs, they come in, not all the time. If the disc injury is relatively new, they will come down like this. We call this an antalgic lean. If I see somebody walking through the front door like this, I know exactly what's going on. I also know when this happened. It's probably something happened in the last few days. Because if that person were to go home and do nothing about it, within a week, they're going to look like this again. And that is usually misinterpreted as, I got okay. Well, that's not what happened. This is what happened. When you have something like this, your body will not leave it alone. It will try to adapt, or what we said, compensate for this problem. It will actually create its own misalignment here to try and bring your center of gravity back where it's supposed to be. And as if this is not enough, because it's not, because the rest of them still doesn't look good, the shoulders have to be level, and it'll create another misalignment here to compensate. You're going to look like this. Now, it's not really confusing for me that every time I take a picture of a person who's had an injury, I wind up seeing something like this, but they're usually very surprised to see this because they look at themselves. The head looks good, the shoulder looks level, the pelvis looks pretty good. There's a problem with this. Okay, let's talk about why this is a problem. Not only do we have a disc problem here, but we have what we call compensatory misalignments. When you herniate these annular fibers, the nucleus moves out of position. Now we understand that two things cannot occupy the same spot at the same time, right? It's not possible for you and you to be standing exactly on the same spot. Somebody's got to move. This is what happens when you herniate these fibers. The nucleus winds up pushing off to the side. As a result, whatever was here gets pushed out and creates this. What do you think that is called?
A bulging disc.
That's exactly what that is called. And ultimately, why is a bulging disc such a bad thing? So, it's a bulging disc. It's inside. Nobody can see it. Your spine's already corrected itself a few times. Who cares, right? Anybody know anybody with a herniated or a bulging disc who is absolutely comfortable all the time? It is a problem, isn't it, right?
Yes.
Why do you think that's a problem? What do you think exits right out here?
The fluid?
That is a nerve. Okay, let's take a look at it. What are these yellow things right here?
Nerves.
Nerves. Okay. Now look how conveniently the disc and the nerve are all at the same segment and level. You see that?
Oh, wow.
They're pretty close to each other, aren't they? So, and conveniently, whoever made this little plastic model was very helpful to me because they also put a bulging disc over there. Can you guys see that little red thing?
Oh, yeah.
Okay. When this thing bulges out, now two things also cannot occupy the same space at the same time. The nerve and the bulging disc now are competing for space. Who do you think is going to win that battle?
The bulging disc.
That's right. Actually, it's been said that the spinal cord itself has roughly the consistency of cream cheese. Is that tough stuff, really tough material? Would you build a house on cream cheese?
No.
It's not exactly built to hold you up. It's not exactly built for anything coming in there and messing it up. When this bulge goes out and starts to compete for space with the nerve loses. Anybody heard the term sciatica?
Yes. Yes.
What is sciatica? Sciatica is essentially the name of it's the biggest nerve in our body. Usually nerves are tiny little strings going all over the place, but in this case it's like a rope. It actually goes down the back of your leg right here. Now anybody who's ever had sciatica will describe several things. One is it feels like a sharp pain going down the back of my leg.
Correct.
And if it's bad enough, it's going to be accompanied with numbness, tingling. Sometimes if it's bad enough, it'll actually start to translate into atrophy, motor neuron problems, foot drop. In other words, when they walk, they can't lift their foot up. There's a lot. We're not going to go through the whole list of bad things that happen to people when this happens. But when you put pressure on nerves, bad things happen. One of them is pain. I always like to ask this question. If you were to put a definition to the central nervous system, what would you define it as? What is the definition of, I want everybody to think about this. What is the definition of central nervous system? Well, what I did is I went to Grey's Anatomy. Anybody heard of that?
No.
It's not just a TV show. It's actually a book. And if you go back and read the definition of central nervous system, this is what it says. It is the system which controls and coordinates every other system of the body. Would you say that's a kind of important definition?
Oh, yeah.
Okay. Now, when you put pressure on the nervous system, you get more than just pain. Okay. We all know about sciatica. We all know about that pinched nerve that goes down the arm. We all know about the sharp pain that's associated with those kind of things. Very important to take those in mind, but more than that happens. Research has shown when you put pressure on a nerve, you create what is called hyperreflexia down the pathway of that nerve. Have you guys ever gone to the doctor and they tap on your knees?
Yes.
Okay, what happens when you tap on the knee?
Yeah.
That's right. Now, if I were to tap on that knee, then I tap on the other knee, and one of them just kicks up a little bit, the other one kicks right up like crazy. Is that a bad thing?
Yes.
Okay, that's what we call hyperreflexia. So we know how to measure it. Everybody knows it exists. That's why they're always testing you for it. What happens is when they tap on one and it goes up a little bit, the other one goes up a lot, they know there's pressure on the nervous system somewhere. Okay, since it's such a broad thing, they're not telling, oh, a specific nerve right there. It could be a brain tumor. They don't know, but ultimately they want to make sure these things are even because what they're measuring is exactly what I mentioned. Now let's talk about how the nervous system affects the lungs. It's very important to understand that the body is a very dynamic mechanism. The fact that I'm standing here talking means I'm expending more energy than you guys sitting there listening versus somebody who is running a marathon down the street. He's expending a lot of energy. Whose oxygen needs do you think physiologically are going to be higher, the marathon guy or you guys?
Marathon.
Okay. How does the body adapt and actually supply all of this? Well, one of the things that it does to the lungs are filled with these little sacs we call alveoli. Those alveoli are not constant little pockets. They expand, they contract, they're constantly in a state of dynamic compensation for what it is that our physiology actually needs. Who do you think controls that expand, contract, expand, contract?
The nerves?
That's right. Now, we already know that when you put pressure on a nerve that goes to whatever organ it goes to, it's going to have hyperreflexia effects. So that means those alveoli are not going to exactly respond properly, are they? If we were to actually look at it, I have a little chart here that shows it. I'm going to just read it for you because it's hard to see it. But T1, the first symptom that follows it is asthma. Okay, very important to understand. Now, there is a treatment for asthma in medicine. They're little inhalers, aren't they, right? Okay, some of you are nodding vehemently because you've experienced it. Now,
yes.
what happens What's in that thing? Some of it is adrenaline, okay? Some of it is, there's stimulants in that stuff. Why do they put stimulants in those little inhalers? Because those alveoli are chemically shrunken back down to a more physiologically appropriate size. If I'm taking in more oxygen than I need, that's not good. If I'm taking in less, we know that's not good either. So in many cases, not all cases, I mean there's variations to a lot of the stuff I'm talking about, but in many, many cases, the reason people get those type of symptoms is because the central nervous system is not able to properly adjust to its environment. And the primary way we can interfere with the central nervous system's ability to adapt to its environment, messing around with those nerves.
So if I have a pinched nerve, that can affect my acid reflux?
Yes.
Wow.
Make a long story short.
Asthma also.
See, this is just a microcosm of a nerve chart that I like to give my patients. And what it is, everybody thinks it's something that was made up of a bunch of chiropractors. That's not the case. It actually comes straight out of Gray's Anatomy. Okay? Gray's Anatomy is a textbook that all doctors study. And ultimately, this is a direct correlation that's been made when you interfere with the nervous system at different levels and specific symptoms you can actually follow. Now, I use T1 as an example, asthma. T6, we already talked about stomach troubles, indigestion. See, those are just two examples, but I wanted to cover that to show you guys there's more that goes on with the central nervous system that just cause pain. Let's talk about function. I want to come back to the disc. Remember, the disc, as long as the nucleus is right in the middle, everything's going to have what we call symmetry. Whatever sits on top of a good disc is going to sit nice and parallel. We already covered some of that before. There was an important thing to understand about the location of the nucleus. Remember the location of the nucleus, right in the middle. What that's going to do for us is allow the bone sitting immediately on top of the good disc to have full range of motion. It's going to be able to pivot all the way around, sitting on a central axis. That is what we call proper disc function. Let's go back to this. You think we're going to have proper disc function here? This is not going to be able to move the same way this way as it is going to that way, is it? No. Now we have disc dysfunction. Okay? This is why people say, you know what, when I lean this way, oh, that hurts, but this way I'm fine. Now you know why. That person right there basically is reproducing an orthopedic test we call KIMPS. This is how I test people. When they come in, I move them this way back, and if that hurts, well, it doesn't, well, it goes, oh, I can't go that way. Well, guess what? Almost every time, that is diagnostic for you have one of these. Okay. Another important thing to understand about a disc function. Discs are really not vascularized past the age of 16, 17. So you guys are getting to that point. Say bye-bye to vascularity to your discs. So then how is it that we don't all of a sudden wind up in a wheelchair at the age of 18? Well, this is how it works. Discs rely on motion for fluid exchange. When you move around, you create fluid exchange. It's important to have fluid exchange because these are still living cells. They still need nutrition to come in. They still need waste products to go out. So when we have function, that's not a problem, right? When we have dysfunction, that motion is either greatly reduced or is gone. What happens to that fluid exchange?
Doesn't happen.
It doesn't happen. What happens to living cells that are no longer getting proper fluid exchange? They dehydrate, they lose their normal physiology, they get, essentially this is what happens. I'm going to go back to the bad disc I showed you guys before. If you look at it, it looks like a dried up piece of apricot.
Yes.
This is why, because it's gotten dehydrated over time due to lack of function. I can always tell when I'm looking at somebody's pictures, not just where's the bad disc, what happened to it specifically. Also, I can usually tell how long ago you injured it. How am I able to do this? Well, there are several ways I know how to do this. One is, the disc height is important. As this disc dehydrates over time, it starts to collapse and go away. That's what happens. Now, your body is smart. It will always respond properly to what dysfunction it actually experiences. When it comes to a bad disc, it will actually have several responses in mind. The first thing it does, and most people are familiar with this to some extent, it puts all of the paraspinal muscles or surrounding musculature into spasm. This is not a bad thing. Okay? It's very important to understand. You've seen these people, right? Oh, I think I hurt my back. You call their name, they can barely turn around, they kind of turn around and look at you like that. Why are they doing that? Because all of these muscles are in spasm. It's not a bad thing. It's important to understand because when a disc goes bad, remember, it's holding you up. A bad disc isn't really holding you up very well. And your body is going to be extremely sensitive about a bad disc that's not holding you up still having to be there because it has a very important responsibility. Look who's back here. What is that? The spinal cord. You think the body's going to be slightly protective about what happens to this guy?
Yes.
What if it's not protective? What if I don't care. Let the whole thing collapse as far as I'm concerned. What's going to happen to that spinal cord?
Hurt it?
You're going to be paralyzed. Right? Anybody want to be paralyzed?
No.
Okay. Very important to understand, if you're paralyzed, you're not going to be able to survive. That's how your body is designed. It's really in terms of survival. If I'm out there as a hunter-gatherer tribe and my village relies on me for hunting and gathering and I'm paralyzed, right? Am I going to be able to provide? Am I going to be able to survive? Basically, it's a death sentence, you know, in a situation like that. So your body, being interested in survival, immediately goes, no, 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 no. I can't let that be injured. So I'm going to immediately leap into action. Basically, like paramedics at the scene of the crime. The first thing they do is they put these muscles in spasm. And you, the suffering patient, wind up in a hospital or some other setting, and a well-intentioned doctor gives you muscle relaxants. So what do you think the body's long-term solution going to be? Well, Italian engineers are smart enough to look at the Tower of Pisa. You guys seen the Tower of Pisa? Does it look normal?
No.
Something's wrong with it, right? Well, it's a great tourist attraction, so that's great. If it wasn't leaning, nobody would be cared to see it. But, you know, it's not sitting like this, is it? It's doing this. Now, over the centuries, it's actually gone more and more and more and more and more this way. This is essentially what happens to things when they start to go into a state of dysfunction, just like with buildings. If you leave them alone, they eventually collapse. We're the same way. Once that building starts to go more and more and more into this position, Italian engineers look at it, a couple of more inches is gone. Poof! No more tourist attraction. So they look at it and they go, wait a minute, that can't be. We're going to have to stabilize this thing so it doesn't go any further. What have they done? I was reading about this in National Geographic. It's an interesting article. So they put a lot of stuff down here, concrete and mortar and counterweights and things like that, to physically stop it from getting worse. The other thing, they've also got cables hanging off us. So Italian engineers are smart enough to know this. Our body is smart enough to know this. It does almost the same thing. It looks at this and go, hey, I can't let this just collapse. If it collapses, I'm paralyzed. I don't live anymore. I got to do something about this. What tends to happen is the body will actually start laying extra calcium around the rim of the joint, creating more surface area, mechanically stabilizing it. Now, it's not going to move as well, but at least it's not going to collapse as fast. See, the body is always interested in cost and benefits, cost and benefits. If I put muscles in spasm, I'm not going to move as well, I'll be in a little bit of pain, but at least my spinal cord is not going to collapse. I'm going to put all this calcium around there, yes, it's going to interfere with some motion, and eventually it's going to start creeping into little holes where the nerves come from, and those holes are going to get smaller. I might have some spinal stenosis. Anybody heard of spinal stenosis? Yeah. Okay. That's where spinal stenosis comes from. Anything that goes into a hole where a nerve is supposed to live, whether it's a bulging disc, whether it's these bone spurs, that causes spinal stenosis. There's other things that cause it, but those are the two things that more often than not. If you ever read enough MRI reports, you tend to see that a lot. These bone spurs have a function, stopping you from collapsing as fast. You know what we call this? Arthritis. Okay. Now, people have gone to doctors enough to know when they're being diagnosed with arthritis, there's another word that immediately follows arthritis. Age. Right? Now, invariably, if somebody past the age of 50 or 60 winds up in a doctor's office and they take MRIs, x-rays, whatever they do, and they go, Doc, my back hurts. Why is my back hurting? Well, you got arthritis. Usually end of discussion, right? Okay, well, why do I have arthritis? Well, you ain't no spring chicken, right? You know, you're past the age of 28 was the youngest patient that I've ever had that thrown at them. You're not 18, so you're going to have arthritis. Okay, well, I got an argument against that. Arthritis is usually associated with age, isn't it? At least that's what we're told. And a lot of times when we don't have proper answers as to why some people get a lot of arthritis, some people seem to get a less arthritis. What is the second explanation that's usually thrown at patients when that happens? Genes, right? Well, genetically, that's how it is. It goes back to your parents or grandparents where you just start to fall apart because that's how you're genetically designed. Well, or age. Those are the two things I'm about to debunk right now. Okay, and I'll show some pictures in a second that will show what I'm talking about. If you look at enough MRIs and X-rays, you'll notice a few things. When people have arthritis, you look at all the discs. If it were an age thing, if it were a genetic thing, you would imagine that all of them would become arthritic uniformly, right?
Yeah.
The discs are all the same age, right?
Yes.
The genetic material necessary to develop all these came from the same DNA, right?
Correct.
So then why is it that that's not ever what we see? What we tend to see is massive amount of arthritis building up around one disc, a little bit less here, not much here at all, then it's a lot over here, then again not much over here, then more over there. It seemed to be in pockets of activity where the rest of the body is just looking great. I got patients in their 90s and you look at them and most of their discs look fantastic. Problem is the one that's really bad is really, really bad. Ultimately, remember, we're going to go back to kind of what we were talking about earlier. When you have disc dysfunction, you're going to have arthritis associated with that. We talked about why that happens. If you have compensations, you're going to have arthritis associated with the compensatory area. Then all of a sudden you got this. So you could very clearly illustrate every night and every day of the week that arthritis is associated with mechanical dysfunction, not age, not genes. Now, if I had to be in a court of law and establish that genes have nothing to do with it, I can't do that. If I had to say age has zero to do with it, well, maybe I can't pull that off either, but I can tell you this. Those are extremely, extremely low on the priority list as to what brings arthritis about. It's mechanical dysfunction that brings it about. Okay? Otherwise, all those discs will be uniformly bad all the way up and down. Does that make any sense at all? Okay.
Yes.
Now that we've established what a bad disc is and all the side effects, a very important part has to come up. What do you do about it? What do people with bad discs do? Okay. How many options do they have available to them? Okay. Well, I'm going to go through them as quickly as I can. Epidurals. Anybody heard of epidurals? Okay, most people have heard of epidurals. What do they do in epidurals situation? Well, what they do, they inject that segment full of steroidal anti-inflammatories, and they usually it's got some analgesic effects to it. The idea is to numb the nerve and get the inflammation down as much as possible. That way, they create some relief for the patient. Now, does that do anything to change the structure of the disc?
No.
No. So what is the purpose of it? To create relief. Okay. I call that hospice care. Now, what does that mean? It literally means let's keep you comfortable while you're dying. That's essentially what it means. They've done absolutely nothing to change you mechanically. There's another thing that happens that people with really bad discs tend to be referred towards. And we call that spinal surgery, right? Now, not all spinal surgeries are the same. There's specifically 3 different types of things they do. One is called a discectomy. They got different variations now. They do they're called minimally invasive, different things, but it doesn't matter. Ultimately, they boil down to the same thing. Let's look at the anatomy of a bad disc. You got the bulge here, you got the nucleus going off to the side, annular fibers are sick, squeezing into the nerve, therefore you're not exactly happy. So what they do in surgery, they go, wait a minute, we know what's causing your pain. And they're right, they're looking at the MRI, they know which one's a bad disc, usually they do. And they go, look at this thing's bulging out, so what we're going to do, we're going to just get rid of that bulge. Okay. Okay. Now, nothing's squeezing in that nerve. Does that disc look healthy now?
No.
It's still not a happy disc, is it? Okay. But you figure, what the heck, who cares? The bulge is gone and there's no pressure on the nerve. okay, then you would say, well, that's the panacea that fixes everything. Ultimately, then why is it that spinal surgery has such dismal results? There's one other thing that they do in spinal surgery. It's called a laminectomy. Laminectomy, I'll explain that real quick. This portion of the bone right here, that's called a lamina. They saw this part out, and just remove that bone. And the idea is to take the pressure off the spinal cord, and since the lamina goes down to the back of the nerve, the idea that, well, the bone's not there to squeeze on anything anymore, so as a result, the nerve is free and you're fine.
Oh, wow.
Okay, there's a problem with that. These things have a weight-bearing function. They actually help hold you up. Actually, the way it's been described is that if you look at the spinal column from the top, you got the disc, you got these two joints right there. It's really like a tripod configuration that's giving us our full stability. If you take any tripod and take two of its legs away, what's going to happen to it? Not exactly a happy thing. So as a result, laminectomies down the road tend to not have the best results for this reason. There's another thing they do in surgery, which is, let's just take, well, there's many ways of doing it, but I'll describe one. Let's just get rid of this disc and just fuse it all up. Fuse it. The disc isn't there anymore. Those holes are nice and big and wide and open. We shouldn't have any more problems. Is that the case? Then why is it that a lot of these spinal surgery patients tend to, also with fusions, tend to be bad? Because I see a lot of them myself. When you get rid of all function, now you get zero. Does that make sense? Okay? If you have a car where one of the wheel wells is not doing too well, and the mechanic's answer is to just fuse that wheel to the rest of the chassis, now we're not going to have any problems with that tire anymore, right? Now go off driving down the freeway. How is that car going to drive?
Not so well.
You would not do too well with that car. When you get rid of all function here, your body is going to have a problem dealing with it. And usually what tends to happen, actually almost every time what tends to happen, the disc immediately above it starts to get pulverized almost right off the bat. Because that disc doesn't really have the ability to compensate for the fact that underneath it all function is now gone. So now you're going to have a second disc problem that's very quickly going to be in your hands. And guess what's going to happen down the road? You're going to need spinal surgery. That usually becomes like a serial spinal surgery effect, where you go jumping from one to the next. Is all spinal surgery bad? I'm not saying that at all. If you go in there and this disc is ruptured, you need spinal surgery. If it's sequestered, I'm going to go down a few things. Yeah, you need spinal surgery. If you have actually broken pieces of that, if you have stuff hanging out into the spinal canal and there's debris involved with that, you need spinal surgery. There's time and place for spinal surgery. I think the most important thing to understand is what is the cause of the bad disc. The cause of the bad disc in this situation happened to be that the nucleus is not where it belongs. Now, a logical person might look at this and go, why don't we get the nucleus back where it belongs? What are we trying to accomplish by getting the nucleus back where it belongs? Remember, a bad disc is a complex array of situations. One of them is you get a bulge, squeezing down a nerve, you get a lot of scar tissue formation happening here. The disc itself is dehydrating because it's not moving, so we got lack of function, you got nerve compression, we also have a lot of connective tissue damage associated with it. All of these have their own symptoms. By getting the nucleus back, what are we actually accomplishing? We're taking the pressure off the nerve, we're restoring function. This is very important to understand. In my opinion, in my feeling, it's more the fact that we're restoring function to that disc is more important than all the pain you're in. Because that's what eventually leads to complete dysfunction. And that is this disc right here. What does that look like to you guys? I call it beef jerky. Okay? When a disc completely dehydrates and goes away, it looks like beef jerky. There's no definition. There's nothing you can do about this. And what happens when these bone spurs have gotten big enough where they're all touching now and fusing?
Oh, wow.
Okay? What is that? That is called complete 100% dysfunction. This is the sort of thing that lands people in nursing homes. Because you're no longer able to take care of yourself, you're no longer able to hold yourself up. The nerves have no place to go. You got so much stenosis going on in the spinal canal and the nerve roots that these aren't functioning anymore either. So you lost function. You can't take care of yourself. So ultimately, if we do have a mechanism, this is the big if, because this is basically where the only part any questions can be raised. If we do have a mechanism for getting that nucleus back where it belongs, then it's going to be hard, you guys are going to be hard pressed to make a case that, forget it. Okay, because once we get that nuclear material back where it belongs, let's just assume that's what we're doing here by doing this. What's going to happen to these annular fibers? Well, I'll explain. They will heal up. What's going to happen to that bulge? There's really no reason for it to be there, since there's nothing pushing it out. What's going to happen to this mechanical dysfunction that's associated with this tilt? Well, we're going to basically be influencing that back where it's supposed to be as well. I'm going to show you some exercises that will illustrate this quite clearly. Ultimately, though, very important to keep expectations realistic. Am I going to take a 90-year-old who's had a disc problem for 40 years and give him a brand new 18-year-old disc again? It's impossible. Okay? This is a degeneration scale right here. The further you go down into the scale of degeneration, the harder it's going to be to take you back down to exactly nothing happened to you. If it is a recent injury, yeah, you can do that. Fix it. If it's been there for a while, we'll bring you back as far as we can, but you're going to be limited by how much degeneration is actually taking place in the disc. But you can always improve it. But this is our goal. Ultimately, this is our goal. Get the nucleus back, take the pressure off of the nerve, and restore function. Now, going back to what disc function is all about. When a disc is moving, it's creating fluid exchange. When it stops, you've lost that, now you're dehydrating and going away. When you get that thing moving again, guess what tends to happen? It actually starts to regenerate. Over time, a bad disc can get better and better with time as long as it's working. This is a pretty typical presentation of a person who's had a relatively recent disc injury. Now, I'm going to show you guys, because when I show you what happened afterwards, we literally call this fixing a disc. Now, you can just look at this picture and know that there's something wrong, right? Okay? It looks a little crooked, doesn't it? She's not exactly going straight up and down. Now, this is a situation where you can very clearly see, once you do all your homework, which is what we do in the technique I practice, you find out that vertebra is tilted. The ones below it look fine, but right there, right at L3, everything kind of tilts over, then the rest is just all compensations all the way up. Now, when I take relatively recent disc injury, this patient was like this for months. And when she first came in here, she couldn't sit, she couldn't stand, she couldn't do anything. She was doubled over in pain, just basically crying the whole time. But when I took a look at it, I knew where the problem was. Now, after our treatment protocol, because I always re-picture the patient afterwards to see if everything's where it's supposed to be. This was her after 90 days.
Oh, wow.
Does that look better?
Yeah. Yes.
Okay. There's only one way you could accomplish this, and there's only one way physiologically you could accomplish this. You could see that L3 right there now is sitting nice and parallel on top of the bone as supposed to. Isn't that exactly what I was talking about? Get the nucleus back into place. As a result, the asymmetry in the joint now disappears, the nucleus is back in place, the annular fibers heal up, the pressure is off the nerve, the connective tissues will heal. More importantly, and this is the most important part, the function is back in that disc. And it's important because this is a relatively young lady in her late 20s. What would happen to this lady if we didn't fix that disc? You think maybe some degeneration, some bone spur formation would happen, maybe it's down the road, arthritis, spinal stenosis, scar tissue. I can go on and on. You know, what happens with pinched nerves, what, you know, all the stuff that are associated with that. What happens if that patient was not taken care of? You think all this stuff would unfold in her life? This is why I'm saying that getting rid of disc dysfunction is even more important than just pain. It might even look like almost the same x-ray. It's not, trust me. But it's a similar set of physiology going on. Again, the discs are all nice and parallel, everything good. Big giant angle, compensations, a lot of the same story taking effect here. Very important to recognize exactly which disc it is you're working on. And remember, we're talking about MRIs. Don't get me wrong, I'm a big fan of MRIs, but the fact that they're taken lying down more often than not really can be misleading as to exactly where the bad guy is. And that's what I like to call the bad guy versus the compensations. But when you preload it by standing, then you can see everything. There it is, right there. So, again, same person. Okay. Not bad, huh? Now, again, same question. What would happen if this patient was never taken care of? All those same things. Now, I want to show you guys somebody who is a little bit older injury, because I want to illustrate that you don't always reach perfection. It all depends on how recent your injury is. Does that spine look good?
No.
It looks like it's tilting. The Tower of Pisa comes to mind, doesn't it? Okay. Now, right here, this person happens to have an extra disc. Some people have 5 lumbar, some people have 6, but that's a different story. Right here between L4 and L5, there it is. You could actually visualize it. I got a little ruler that I use to see what's going on, but you guys don't even need it. If you look at it, you can see this is parallel, this is parallel. Right here is where everything tilts over and goes crazy. Now, all of the stuff that you can see right there is what we call compensation. Here is the same person 90 days later. Now, the reason I use this is because even though it looks a lot better, there's no doubt, it's not perfect. There's still some curvatures there, there's still some arthritis there. This is definitely an illustration of what happens when an injury is a little bit older. And you're not going to be able to get it to be perfect, but you can improve it a lot. Now, depending on how old the injury is, how much degeneration is going on, that scale will remain. So, I got one more I want to show you guys, because I want to show you guys that you don't always get disc herniations in your low back. Sometimes they happen other places. Can you see this person's head?
Oh, yeah.
All right, what are they doing? This is what they're doing. There's actually a term and diagnosis associated with that. This is what we call torticollis. Patients with torticollis, they're stuck like this. You call their names and they turn around and look at you like this. You think this is a comfortable way to live?
No.
She was like this for months when I met her. I've had a patient who was like that for years before I got to see them. This is a compensation for a disc problem right there. This was after a traffic accident. You can actually have a disc problem right there. You can see, yeah, if you measure the patient goes up nice and okay, then right here everything takes a wild turn to the left and it's all compensating, and all these muscles right here have gone to spasm in a splinting fashion trying to protect that disc. Remember, the body does cost and benefits analysis. Should I really go after protecting that disc and create this, or should I just leave it alone, let it all collapse and be paralyzed? What do you think it's going to pick? That's right. Okay, so now the patient's like this. This person, as well as another patient of mine, very presented similarly, they had gone to their doctor and they were injecting Botox into these muscles right here.
Oh, no.
Okay, Botox is basically the active ingredient in Botox is botulism. Okay, what does botulism do? It creates paralysis. They're trying to paralyze these muscles so the patient can stand straight up. It almost never works. They do it anyway because they don't know what else to do for these people. If you try to paralyze those muscles, it doesn't work. The patient's still like this. Why do you think that is? Well, you'd literally have to paralyze everything on this side of the body, because even if you were to be successful in paralyzing this muscle, the body will employ another muscle behind it, in front of it, and around it, trying to accomplish the same splinting mechanism. That's why it never works. You'd have to literally paralyze half the body for this thing to create enough. Well, even then you're not going to stand straight up. Well, as soon as we figured out where the bad disc was, is that looking better?
Yes.
Any Botox necessary?
No.
Any massive amount of muscle relaxants necessary?
No.
It's very important to understand, because when you're like this, like another patient I had, they take your driver's license away. You can't, basically your life is taken away essentially. You can't function. What are you going to do this way? So it was always considered to be relatively untreatable condition. It was like the syndrome. Anytime you hear the word syndrome means we're not sure. That's basically what syndrome means. Torticollis, more often than not, is a splinting mechanism for a bad disc, which creates this sort of thing. And ultimately, what we have to do is restore functions of that disc, and guess what? The body isn't stupid. There's no reason for it to keep you like this, and it needs to. Once we took care of the disc, we go, I don't need that anymore. Doesn't that make more sense?
Wow.
Okay. Is torticollis a disease or a side effect?
Side effect.
Is arthritis a disease or a side effect?
Side effect.
Is sciatica a disease or a side effect?
Side effect.
I can go on and on. As a matter of fact, this whole list down here, you could make a big giant argument that these are not really diseases, they're side effects. And don't get me wrong, every one of them has medication that's associated with relieving you of those symptoms. With limited results, they sometimes do. But ultimately, it makes more sense to actually treat the patient in terms of cause. That way, you get rid of the effect versus trying to treat the effects for the rest of your life.